Hi, welcome to the Wellness Dentist podcast and webinars. For today's wellness series, we have Dr. Tracy Wakefield with us. Dr. Tracy, can you share with us about who you are, what you do? I want the audience hear it from you.
Absolutely. So my name is Tracy Southwick. I'm a naturopathic doctor. I have a clinic here in Houston, Texas. I have been in this field for almost 30 years, and I am super passionate about detox, especially parasites, which we'll get into tonight. So that is great. And I think it's so wonderful that so many dentists are actually embracing that, because I am also very passionate about the connection between your health and your mouth. And just bringing that all together can really, really help people healthier and healthier in all areas of their lives.
That's beautiful. And in the last few years, we have a lot of mutual patients, and we've seen the health transformation and the correlation between parasite and how common it is among everyone, not just the patient, even us and our families and our friends and our circle. And that's the reason why we asked Dr. Tracy to come on and share with us the basic information. And then you got to have a Q&A session with Dr. Tracy. And so let's get started.
Sounds wonderful. Thank you so much for having me.
Thank you.
I'm excited to be here, and thank you all for being here to watch this presentation. So I know I'm starting off with a yucky picture, but I'm really going to talk about parasites as the overlooked pandemic. People, especially in America, tend to think that they don't have parasites, that we're clean, right? We're in we're in a first world country and we're clean and we don't have parasites. And that's just simply not true. We meet people from other countries that normally will treat for parasites a couple of times a year, and they understand that that's just part of how things are. But I hope you'll understand with this presentation that it is an issue and it can make significant changes in your health if you address it. So I don't have parasites. Yuck. I know, it's kind of gross. Actually, I wasn't going to tell this story, but I'm going to tell this story because it really got me passionate about parasites. Many years ago, my husband was sitting in a car with a doctor who does autopsies. So he was talking to this man and he said, "Hey, I have a question for you. Have you ever seen parasites in somebody that you did an autopsy on?" And the man looked at him and he said, "Oh yeah, I've seen lots of parasites." And my husband said, "Well, like what percentage of people that you do an autopsy on have parasites?" And the doctor looked at my husband and he said, 100% of the people I do autopsies on, I see worms. And his follow-up statement was, "People are disgusting." Well, I'm sure if you do that and see worms all the time, you would feel that way too. But it's something that we just don't think about. And if you think about the fact that 70 to 80% of parasites are microscopic, this man is seeing the 20%, 30% that are actually visible to the human eye. So if you have a pulse, you have parasites. Dr. Jay Davidson, if any of you are familiar with him, he's one of the founders of Cellcore, and I do a lot of work with Cellcore. Their products are amazing. And I use their products a lot in parasite cleansing, but that's one of his famous quotes is, "If you have a pulse, you have parasites." So if you're squeamish, don't look at the rest of the pictures that I'm going to show up just here in the next minute. I'll tell you when you can open your eyes again. But these are pictures of just recently in the last few months, parasites that have come out of some of my clients. So there's a nice one. There's another icky one. That looks like maybe a few. And then this one here, that was actually a few months ago. And then we've got one with a measuring tape. Actually, I think she had even longer ones. This woman with the measuring tape has passed hundreds of worms. And it's amazing because her energy is better. She's sleeping better. She's lost weight. Her stomach's gone down. So it's exciting to see those changes in people.
I hear that a lot from our patients.
Yeah.
They come in, they said, "Oh, I sleep better. I lost weight and my energy is better." And I was like, "What did you do?" Are we always curious about that? And the common answer was like, I'm going through parasite cleanse, and a lot of them are your patients, so they are working with Cellcore, and that's what get us really interested. And that's the reason why our whole team are going through a parasite cleanse together.
I love that.
And we can totally see that in our team members. Energy levels up. We're so close that we can share medical
Yes.
information with each other. And I noticed that in daily activity, they have more energy, they sleep
Excellent.
better, and they also have a lot more clarity.
Yes.
The brain fog. that we
Brain
talk about.
fog, it's huge. And I have people that just say, wow, I used to be really creative and I lost it and now it's come back.
That's
So
beautiful.
if you think about the toxins that are present, I'll get into this in a little bit, but the toxins that are present that create the environment for parasites are very toxic to the mitochondria of the cells. And you've got about 10,000 mitochondria in each brain cell. So if you're cutting that maybe in half, you're going to notice a significant amount of brain fog and memory loss and things like that. So absolutely, I'm glad that you're seeing that.
Yes.
Okay, new slide. You guys can open your eyes, the squeamish ones. So how do we get them? Obviously, you can get them from travel, but you can get them from birth. So think about a lot of women, it sounds terrible, but they can have parasites in the birth canal, or also if the baby swallows the meconium, that can implant parasites into the body. So you can have it from birth. Our pets, people sleep with their dogs, they sleep with their cats. I have a dog that is definitely a part of my family, but if you pay attention and see where they're sticking their noses and when they're licking, it's really a big deal. And people say, well, I deworm my dogs or my cats. I give them heartworm medication. That only covers a very small amount of parasites. So you need to really get more in depth in terms of deworming your pets at the same time you're deworming your family members. Family members pass it back and forth. So is your husband on the? Okay, good. Pass it back and forth. Sushi. I just saw somewhere the other day that one bite of sushi can have 10,000 eggs, parasite eggs in it. So that's why the Japanese do ginger and wasabi, because that kills parasite eggs. But you have to do kind of a lot. And the wasabi that we get here in the States isn't real wasabi. It's just horseradish. So wasabi is much, much spicier and kills eggs better. Raw fruits and vegetables, you know, even if they're organic, actually, sadly, almost especially if they're organic, because a lot of times they'll use manure as a fertilizer, and then you get the eggs on there. So soaking your fruits and vegetables in like a vinegar solution or something like that, or using an oil and vinegar dressing can be really helpful. Water, lakes, rivers, pools, anything where the water is stagnant, like a lake, can be loaded with parasites. Your yard, just walking around, I'm all about grounding. But walking around barefoot, you can also get parasites through that. And really anywhere, you can get them on a doorknob, you can get them from a hand towel that you use, you can get them from a faucet. So, you know, not to scare people, there are solutions, but just understanding that it is prevalent. It's just part of nature. It's part of the environmental biome that we have. But when our bodies get out of balance, an environment is created where parasites can thrive. So why do we get them? And that comes from a toxic body. So parasites are actually there because our bodies are harboring toxins. It's impossible to stay away from them, as we know, right? We're breathing the toxins. It's in the water. We can do all that we can, but it's really hard to have no toxins in our body. You can get them, obviously, toxins from heavy metals, pesticides, mold. We live in Houston. They're spraying us with pesticides. I remember after Hurricane Harvey, my daughter's playing tennis, and she looks up and she recognized it because I had told her, be careful because they're spraying for pesticides. And she saw the planes going overhead and ducked down and hit herself. And all the other kids are looking up. And when she raises her head, they're all covered with a white film. And so all that's absorbed into your body. And we're exposed to things that we're not aware of a lot of the time too.
That's right. Especially for dentists, I know a lot of dentists are listening. Heavy metal is so common in dentistry.
Absolutely.
And even though they said, oh, I don't place metal crowns or metal fillings anymore, or what we call amalgam filling with mercury in it, but they remove them every day.
Yeah. Well, and even if they're not removing them, they're working with them in the mouth, and it creates that
vapor.
vapor.
That's right.
So, and it sounds crazy, but it's actually sometimes a blessing to have those parasites, because they absorb many times their body weight in toxins, but then they release toxins into the body. So it's this beautiful, careful dance that you have to do when you're detoxing from parasites. You also have to detox from those chemicals and the heavy metals.
Yeah. I personally actually going through that right now. So when you helping me with the parasite cleanse, my heavy metal level rise up.
Because they're releasing it. As
Mhm.
you kill the parasites, they
Mhm.
release the heavy metals. So you've
Yes.
got to take binders and do
Mhm.
things to help move those out.
That's
Yeah,
right.
that's interesting. So that's actually something really important to note. If
Mhm.
you are going through a parasite cleanse, don't worry if those numbers start to rise. It means your body's stirring things up and it's moving it out.
That's perfect.
Yeah, I see that with cholesterol a lot too. People's cholesterol levels go way up while you're detoxing. And they'll go to the doctors, and the doctors get all worried. No, it's okay. Your body's just detoxing.
Awesome.
Yeah. And infections, especially infections in the mouth, all those toxins from dental infections
Yeah.
create an environment where parasites can thrive.
And as a dentist, we think when we talk about infections, we know we're not talk just about infected teeth. We also talk about infected gum,
Mhm.
gum disease, and also cavitation,
Yeah.
which is not very commonly discussed in the US. But outside the US, people talk about it all the time. They actually screen for it in Europe now.
Oh,
So
wow.
that's a great news. Hopefully it's gonna
That's
come.
great news.
Yes, they create some really great tool to
Mhm.
screen for cavitation because they see the impact, the negative impact of that
Good.
on the body health. So I know as a dentist, we know it's so hard to connect the patient with the infection in the mouth because they don't feel the pain. Especially where you have the root canal teeth that infected. They're like, but how come I'm having no pain?
Because you have no nerve.
Yes.
It's killed them.
And also the gum disease, they see the bleeding when they're flossing, but they're like, what is stop the next day? But it's also carried down to the systemic.
It is, and it weakens the immune system. And then, another thing, weakened immunity. So dental infections, environmental toxins, stress weakens your immunity, radioactive elements. Here in Houston, we've talked about this. Here in Houston, in Texas, 80% of the water supply has radioactive elements in it. Houston is 100%. So we're drinking those toxins, and people have radon in the water. I mean, in the air, not the water. Radon in the water, in the air. I'm going to say it again the wrong way. Radon in the air. In a lot of places, there's a radium belt through the United States. Obviously, poor diet and deficiencies and mitochondrial, again, dysfunction, because you just don't have the energy to fight the parasites. You don't have the energy to detox on your own, because our bodies were made beautifully to be able to detox.
That's right.
But we either have too many toxins or we don't have the right nutrition. But usually it's the toxins that cause the deficiencies.
And even in dentistry right now, there's a huge movement about sleep and airway. And that's also weakening immunity when they don't really get the restorative sleep, the deep sleep. They don't get into the delta brainwave. And then therefore, they also put the body in the stress,
Absolutely.
deficiency of oxygens, and the parasites is opportunistic.
Yeah, absolutely. And the brain can't drain. So then you've got a buildup of toxicities in the head, and you can get, and all in the sinuses and everything.
Yes.
So that's super important. I'm glad that you guys are addressing that.
Because I know a lot of dentists screening for sleep, but they don't make the connection between poor sleep and the parasite problem.
Wow.
And the crazy thing is patient aware of the parasite, but also doesn't make the connection between the parasite problem with the poor sleep and airway.
Wow.
So as a dentist, we have to make that connection.
You
for
have
them.
to. And it's a really vicious cycle, because parasites are active at night. So a lot of people wake up, especially around the full moon, but wake up and they're not sleeping really well, and it's a parasite. So we've got to address all of that to get them to a good place so they can get in that parasympathetic mode, the rest and digest and heal mode, and move the body to where it's supposed to be.
That's right. Even though you don't treat parasite for patient, like we refer a patient to you. However, we need to identify that, make the connections, and have that conversation with them. Because I've seen a lot of dentists saying that I'm treating or managing airway problem or sleep problem. How come it worked for this group of patient and it doesn't work for this group patient? And so it's almost like they hit the wall, but they don't know why.
Yeah.
and the disconnect between the mind and the body, that's when I see a lot of patients that don't get the benefit or don't get the conversation
Absolutely.
about parasite.
And I truly believe that the health begins in the mouth. People used to always say it begins in the gut. No, it begins in the mouth. And if you're missing that piece, you're going to hit a wall over and over again. But you've got to look at it from all angles as well. It's just like one of the unfortunate things about the current state of Western medicine is that everything is so isolated and compartmentalized.
Yep.
And that's the beauty of what you're doing and what you're teaching and what you all are doing, I'm sure, and teaching is that everything's connected. Yeah, we have to address the body that way, and the body, mind, and spirit. I do a lot of emotional work. That's a big focus of our clinic. And so if you don't address those things too, and you see it.
Yes.
Absolutely. I know when my husband had a root canal done with you and tears, he didn't know what it was, a removal, and not a root canal, but a root canal removal. And he just tears and tears came out because he was having that emotional release.
When I remember the first time I have that experience when patients have emotional release, because there's so much trauma they're holding in their body, and especially to that particular tooth, it's just unreal. At first I thought they have pain, but no, I have no pain. I just need to let this out.
What
And
a
so,
relief.
yes, this was
Wow.
beautiful. And so now we know what that is, and we actually let them know it's okay to let that go. It's okay to experience that. And
That's
so
beautiful.
It's beautiful. Yeah.
That's beautiful. Low stomach acid's another one. So that's your first line of defense as the parasite eggs potentially, if they're entering through your mouth. First line of defense is your stomach acid. And most people have low stomach acid, not high stomach acid, but low stomach acid.
It's a pandemic.
Yeah, it really is. And what happens is a lot of this acid reflux is actually low stomach acid. I won't get into that too deeply, but it causes the food to ferment and come back up because you don't have enough stomach acid. When you don't have enough stomach acid, it actually affects your gallbladder because your gallbladder goes off of what the pH in the small intestines is. And so if the pH isn't proper because you have low stomach acid, your body's not going to release enough bile. And so you get into this situation where toxins are backing up into the system. Again, infections can cause low stomach acid. And as we age, we typically produce less stomach acid.
Is that interesting that gallbladder removal is the #1 surgery in America?
Is it?
Yes.
I did not know.
And a lot of women actually think that it's okay to have the gallbladder removed because they're in pain.
Yeah.
And they trust the doctor.
Sure.
But instead of looking to the root cause and say, why I'm in my 30 or early 40 and I have to get my gallbladder removed, is this something that I can do to improve my conditions?
Right.
But that's your lost an organ.
I know. It's
I
in there
had
for
a
a reason.
conversation, with the patient recently, and she said, I don't know why my doctor never talked about it. They just put me in the surgery, tell me what to do after the surgery, but never tell me how can I prevent it, or how can I tell other people to prevent it.
Or why did it happen?
That's right.
Yeah. Yeah, it's sad. So looking at the cause, and it's because they just aren't taught that way. It's a different way of thinking, unfortunately. But yeah, I've had great success with working on gallbladders. So yeah, I did not know it was the #1 surgery.
Yes, it's very common. We've seen on medical histories in just our patient in our practice. So that's like the best, I would say, the sample size, because you see that with your own eye, you actually treat them, you see them for years in your practice, and the gallbladder surgeries are very common.
Yeah, and you usually have diarrhea or constipation for like 2 years afterwards, at least the people I know that have had it.
Yeah.
That's not one of my clients, but that is a tapeworm that was something like 56 feet long that was passed. I think it might have been in India. But why does it matter? Why do we need to worry about these parasites, even, in addition to the fact that it's kind of gross to have parasites in our bodies? They deplete our nutrients, especially iron. They love zinc as well. They damage our tissues. They release toxic waste into our systems, and it's a signal that the body's toxic.
Is that fair to see if someone on the blood work and they're anemic? They should definitely.
That is definitely the first place I go. If it's somebody, if it's a woman who's menstruating and she's, losing a lot of blood, there are other issues, yes, that can be it. But if it's someone who says, yeah, I eat meat or I eat all these iron-rich foods and I just can't get my iron up, they're taking B12, I would definitely look into parasites for sure. What are some symptoms? Now, this is just a few symptoms. They can be anything. But teeth grinding, clenching, and TMJ, those can all be parasite related, especially in children. So if you've got children that are grinding their teeth at night, I always look at parasites, always, always. Gastrointestinal issues, you can have constipation or diarrhea. Some parasites actually release a toxin to make you constipated because it creates more living space for them. So that's something to look at. IBS or Crohn's disease, any of those diagnoses that are really just symptoms, I always look to parasites. And I had a woman years ago who came to me because she couldn't control her bowels. And it was horrible. It would be okay afternoon, but all morning long, her bowels were, she had to stay near the restroom. Put her on a parasite cleanse, and within a few months, she's like, I have no problems at all anymore. So those kinds of things that a doctor would have never probably looked at parasites unless she had gone to an infectious disease specialist. Fatigue, number one. I mean, I see that almost always. Pits in the fingernails, ridges, white spots. White spots are usually an indication that you're low in zinc, and that's part of the immune system. It's part of it's super important for the immune system, as we all know, after going through COVID and everybody talked about zinc, but very important for the adrenal glands, very important for the lymphatic system. So zinc is one of the signs I always see with people. First, when I see that they have spots on their fingernails, I ask them if they have stinky feet. And many times they do, and it's because the lymphatic system is backed up and the body's trying to get rid of toxins out through the bottom of the feet. So just a little tip there. If you have stinky feet and white spots on your fingernails, then that might indicate either you're a teenage boy, which they need a lot more zinc anyway, or you've got a big deficiency. Nail biting is one. Two, symptoms get worse during the full moon. Parasites are super active during the full moon. And ask any, ER doctor or kindergarten teacher, and they'll say, oh yeah, something goes crazy in the full moon, and it's probably parasites. And a good portion of the people, it's probably parasites. Mood disorders, it disrupts your nervous system. It disrupts your neurotransmitters and hormones, because most of those neurotransmitters are really made in the gut and not in the brain. Brain fog, big one. We talked about that a little bit. Migraines, headaches, sleep issues, back to sleep issues. Food allergies. This is a great one because people that come in with milk allergies, you put them on a parasite cleanse, oftentimes, many times, the milk allergies will go away. So parasites love the sugar in milk. And so they thrive off of it. And parasites produce histamines, huge amounts of histamines in the body. So when you've got a histamine reaction to something and you've got parasites making histamines, you put those together, the people are going to have a lot more allergies. So, and they're going to have a lot more reactivity to things, whether it's environmental allergies or food allergies. You'll see a lot of sinus allergy issues. So always look to parasites. And most people, when they go through a parasite cleanse, if it's done properly, their allergies will go way down. Yeah.
That's interesting you mentioned about sinus infection, because we have a lot of patients, and I know a lot of these dentists that are watching this webinar or listen to this podcast know what we're talking about. They come in, they said, my tooth hurt, and we do the x-rays, we do the exam, we do the palpation, and the tooth is the victim of the sinus infection.
Wow.
And so we have to understand where to check instead of just go by the symptom of the tooth, because I've seen so many patients get treatment like a root canal or extraction even because the pain was identified as a tooth problem. In fact, it's a sinus infection.
Oh my goodness.
And now you link that with a parasite. And so we have to have that conversation with them and guide them on the right path.
Yes. I have pictures of people when we've done parasite cleanses blowing out little worms. I should have included that. It's kind of gross. You can actually see the head of the worm, and
Wow.
So definitely. So chronic sinus problems, chronic cough, like you can't figure out where the cough is coming from. Again, low stomach acid. So there's that loop, right? You have
Mhm.
low stomach acid, you get parasites, and then you continue to have low stomach acid, nutrient deficiencies again, skin crawling. So when people feel like something's it itches here and it itches here, or there's just something going on, look
Mhm.
to parasites
Yeah.
for that. Itching, eczema, a lot of skin problems. That goes back to the drainage funnel. So parasites back up a lot of toxicity. The body's already toxic and tries to push things out through the skin.
Yeah.
So if the liver's overloaded, you're going to push things out through the kidneys, the lungs, or the skin, or all three of those.
I've seen a lot of your patients told me that they struggling with eczema and psoriasis for years. And
Mhm.
after they do the parasite cleanse, they
Skin
clean.
clears up.
Yes,
Yeah.
yes.
Yeah.
In fact, we actually have a dentist friend
Mhm.
who become a huge believer in self-core
Ah,
because she herself experienced eczema and psoriasis for over 40 years. And once you do the cleanse,
oh, wow.
it's gone.
It's gone.
And so she
And
tell
that whole
patients, she's
time.
like, yeah, she said, I could not believe I using so much cream and go to so many dermatologists, even GI specialists, and no one ever talk about parasites.
Wow. Yeah, it's just not in their radar.
Mhm.
And I mentioned this earlier when we were talking, but the medical community, it takes on average 17 years for something to be scientifically proven before it's actually taught in the schools and considered truth. It takes that long to filter down to the medical community on average, not everyone. And because, they're taught and don't have time to go back unless it's someone like you that I don't think you sleep in a good way. I mean, you're nonstop um, learning and doing and teaching. It's wonderful, and you're open to all this stuff. And obviously, people who are on this webinar are that way too, which is so exciting to see that people are like, I want to help my patients,
Yes.
and I want to be better and feel better.
And you did mention about like compartmentalized, in medicine where they don't get that information.
Right.
But the interesting, if it's 17 years average in medicine, I think it's going to be at least in that 30, 40 years in dentistry. That's scary.
Yeah.
We're adapting a lot later
Well,
than
I
medicine.
see it.
So
I see a tidal wave of it coming in dentistry. I really do. It's amazing. Back when I first got into biological dentistry was in the late 90s and doctor in San Antonio. And he was, kind of the only one in town.
Mhm.
And now, you're training all these people to do it. It's just so exciting to me.
Yeah, but it's beautiful thing that a lot of these dentists actually doing it for themselves too.
Yeah.
Their children, that themselves having health issues.
Yes.
You did mention fatigue. I have
Yeah.
not seen anyone that not struggling with that.
Yeah.
And if we
issue.
can really pinpoint what contributing to it,
Mhm.
they're more likely will find the
Yeah.
relief.
Well, think about you're taking the stress off of the body.
Mhm.
So your body has say you have this bucket full of energy that your body can put into that healing process. Well, if you've got infections or toxicities or emotional stress, your body's using that, or you're exposed to a lot of EMFs, whatever it is, your body's using that energy to put fires out in different areas. And it's just depleting the extra energy you have to go through daily life, right? We
Mhm.
all are so busy. We have so many things going on, but if your energy is all going towards these hidden infections, like infections in your mouth or parasites or toxins, you're not going to have anything left and you're not sleeping, right? So it's just like, of course, everybody's exhausted.
Yeah. On top of that, the modern day, being a moms or
Oh,
being
goodness,
like
yeah.
parents these days are so demanding.
Yeah.
Our job is demanding. And so therefore we feel like it's never end.
Yeah. Yeah.
So
Just need to take a deep breath.
that's right.
Okay, so how do you test? Well, the sad thing is tests are very inaccurate. So think about a bowel test, a bowel movement. You're testing a fecal sample. The parasite, first of all, has to be in the intestines. Parasites can be anywhere in the body. I see liver flukes all the time, lymph flukes, blood flukes. You can have parasites anywhere in the brain,
In the mouth.
in the mouth.
We've seen
That's
them on
not
the
going to show.
slide.
Yes,
It's
yes.
not going to show on the fecal
It's not going to
sample.
show. And the parasite has to be active and in a stage where it's laying eggs at that precise moment that the person is having the bowel movement or that waste is coming out. So very inaccurate. And they're usually only looking for a few parasites where there are thousands of different parasites. So I don't really put much stock in it. If you want to go get one, great, but it's not going to pick up on all the parasites. There are some blood work cues. That is not my arena. I am not a functional medicine specialist. There aren't any definitive ones, but I know that there are a couple of things that you can look for in the blood work to kind of put you in that direction. Obviously, symptoms and a history. If this person lived in India for 10 years or Costa Rica, or, they probably have parasites. Energy muscle testing, which is what we do in the clinic a lot of. It's just a way to work with the nervous system of the body to figure out what's going on internally, kind of like talking to the nervous system. We have a bioenergetics machine that we use that can give us some clues as to that. And really, the most accurate one, I think, like Dr. J says, is the pulse test. That's my,
You're alive.
yes, yes.
Congratulations.
Yes.
Yes, let's get to work.
I know. So how do you get rid of them? You have to remove the source. So if you're getting them from your dog, you need to deworm your dog. At the same time, you're doing a parasite cleanse. Ensure the body is strong enough to detoxify. A lot of people will jump right in and say, oh, I'm going to kill all these worms. If your mitochondria are not strong enough, if your cell membranes aren't pliable to where you can get waste out of the cells and nutrition in, if you're not digesting properly, if your drainage funnel isn't open, so if you're not going to the bathroom a couple times a day, all that stuff's going to back up. The body's going to be wanting to push things out, but it's going to back up into the liver and then back up into the lymph and then try to go out through the skin. And then there's the eczema and psoriasis and those kinds of things. So you've got to keep that drainage funnel open. Usually work for about a month with people, getting their energy levels up so they have enough energy to detox, and making sure that drainage funnel is open so toxins can get out of the body. Our body's a flow system, and most of the times we have a dam built up somewhere along the way, and we've got to remove that dam so things can come out.
Yes. I see that a lot when people are starting a new diet, or like they're fastings or they're quitting something. And especially if they are trying to remove heavy metal, mold, they're fighting things that chronic in the body, and they didn't open or they don't activate the drainage system, they will get skin issues.
Yes.
Like swelling, itching, it worse at night.
Yeah. Yeah.
And they stop because they're scared.
Yeah. It is scary.
Yeah.
It
And
is
so
scary.
you just start, but you never finish.
Yeah.
You just circulate that around.
Absolutely. You've got to get it in the right order. And it just makes such a difference for that graceful and easy detoxification. Herbals versus medications. So there are medications out there. Some people will say, oh, I can take ivermectin, and I'm not a medical doctor. I don't prescribe ivermectin or fenbendazole. One of the things to think about with that I think is really important is that they, just like heartworm medication for dogs, which ivermectin is used for heartworm medication, they don't kill all of the types of parasites. So a good example is I have a woman who was diagnosed with stage 4 cancer. She went to a center in Arizona that was like an integrative center, doing great stuff there. And she had been taking fenbendazole and ivermectin, pretty heavy doses, for 9 months before I saw her. So she actually came to me for emotional clearing work, because we do that as well. And when I actually started putting her on parasite stuff in addition to what they were doing, because she's like, I really feel like I need to do a parasite cleanse. I was like, she, from the first pill she took, and this was cell core stuff that I put her on, so Mimosa pudica, which is they're called Para One.
Yes.
For the very first pill she took, she started passing worms like this long. And for 9 weeks straight, passed worms every single day. And she had been taking medications for parasites for 9 months and never passed a worm. So there was some kind of something different about what that was killing versus what the other one was. So if you've got people that are coming in, oh, no, I've been taking ivermectin for months, doesn't always get them all. There are different parasites, and different things work for different parasites.
That's right.
And I'm not trying to step on any toes or prescribe or anything like that. That's just my experience. When you are working with killing off parasites, you've got to, in addition to keeping that drainage funnel open, you've got to use binders. like I said earlier, when the parasites are in the body, they hold on to, they absorb so many toxins. And like you said, with the mercury levels going up, when you kill the parasites, they're releasing those toxins. So you need to have something to mop up those toxins, and charcoal doesn't do it. Charcoal only stays in the intestines. It's helpful for some things, but you need fulvic acid based binder to get into the cells to pull out those toxins, or to get into the bloodstream or the lymphatic system so that you can get them out and they don't recirculate and then end up someplace else.
I see those binder in the cell core kit. The interesting is different binder for different things, heavy metal, radiation,
Yeah.
right? And so you got to work with a provider and cannot do this on your own.
Yeah, I would highly recommend it. I've had a lot of people who tried to do it on their own and came to me and said, well, I did this, this, and this, and it didn't do anything, or my skin broke out all over. You know, finding somebody who knows how to walk you through that process is really, really helpful. And things change. I mean, you know, I can have the best program recommended for someone and they go out, you know, of my office, and all of a sudden they, I don't know, are exposed to a horrible toxin, you know, somewhere, and they may need extra support. So seeing somebody that doesn't just one-off say, take these and let you go, you need someone who's going to support you through the process, because things change, life changes, and we all have different exposures.
Yeah, I've seen that in our program. You do adjust the dosage. I think that's really interesting, because instead of just sticking to what on the bottle or the label, you actually said, no, during this month, you're going to need support more of the binder or the drainage activator. So I think that's the reason why you cannot play the expert. When you need the help and the guidance, they have to seek for that.
Yeah, I agree. I mean, even I go outside, because you know how hard it is to work on yourself.
Yeah.
You know, I'll go to somebody, one of my colleagues who's a practitioner, and say, okay, tell me what to do. Because I need to get out of my head and just have an outside, you know, eyes on it.
That's right.
Absolutely. So binders, pulsing with children or weak individuals, which just means taking smaller doses further apart so they can handle it. So like you were talking about the dosages on the bottle, those are great, but it's just a starting point. It's a guide. You know, I have a client right now, you would think on the outside, super healthy woman, she takes great care of herself. She can only take 1/2 of one pill.
Wow.
Because she's got a lot of parasites, but she's just, you know, in that space where she's got to start slowly. So understanding that we're all different. We all have different bio-individual, you know, bodies. We're all humans, so we can have this framework of, yes, we've got to do mitochondrial support and, you know, all those kinds of things, and the flow system, but we're also all bio-individual.
Yeah. That's one of our number one, essentially our number one philosophy in treating patients with biological wellness dentistry, is patient had to be personalized.
Yes.
It's the way we look at them, the way we're treatment planning for them, the way we're giving them homework.
Yeah.
So not everyone coming to office have the same homework or the same game plan. And patients do appreciate that.
Yeah, I appreciate it. You're amazing with that. And every single person that comes to see you, that I send to see you, it's like every single program is different, and it's based on their needs. And I just think that's beautiful. That's how it needs to be. You know, we all need that individual care, individualized care. So like I said, every person is different and every detox is different. And some people, 4 months is all it takes. Some people, they have to go for a year. It just depends on how your body is detoxing, the exposures you've had in the past, the current exposures. You know, are you living in a house with mold and trying to detox mold? Well, it's going to take a long time and never going to happen. You can get better, but you can only get better to a point there. And if you're squeamish, close your eyes for this next slide. So this is a client. I talk about how I do the emotional clearing. This is an important aspect of parasite detox. Just like with the dental, the body holds on to emotions. They're imprinted on different things. And with parasitic infections, there's an emotional component to that. So think about the people in your life. Parasites drain, right? They drain you. They take your energy away. They steal from you. Are there situations or people in your life that have done that? So there's kind of like on a metaphysical level, there's something that usually mirrors that in your life. So having someone who can work with you and address those things is really important, or doing some kind of work in that area. So this is just an example of the importance of dressing the whole person. This was a client who had actually a client of one of my practitioners. He had lost his wife a year earlier and was devastated. And in traditional Chinese medicine, the lungs hold on to grief. So, which I'm sure you're very well aware of. And he was about 6 weeks into a parasite cleanse, hadn't passed any parasites, and we were certain that this guy had parasites. I mean, he had 3 dogs that lived in the bed with him. He had worked out on a ranch for years, and it was just like, there's no way he doesn't have parasites. My practitioner, Sonia, did some clearing work, emotional clearing work around grief in his lungs, and he went home and that night coughed up a worm, and this is the worm that he coughed up. So it was about 16 inches long. So that was his lungs had been, and he had lung issues. So his lungs had been holding on to that. There were some also wonderful things at the time that were going on, kind of positive in his life, that worked along with that. But that was an example of just how, you know, the emotions, just like with the dental stuff, once you get to that, the body can let go of it.
I love that you touched that toward the end of our conversation, because I do see that in the practice. There are patients that don't have a lot of dental issues. However, the emotional, their spiritual are really heavily damaged. Is it from trauma from childhood or their past experience? I can tell they also fatigue. They also not be able to keep up with the immune systems and the bacteria in the mouth. Then someone else who have worse condition, there's way more metal, there's way more infection. However, the spiritual and emotional are much stronger,
So
and their physical body can hold on much better. So it's not always, because in medical school and dental school, we always go by the findings, the clinical finding, the physical body, and we completely disconnect with the emotional and the spiritual. And in reality, when we're practicing, we're like, we don't see the same thing. Not everyone having these issues or having these symptoms and I would say suffering. But then there's people that you were like, you have a healthy physical body, but your spiritual and emotional body is really making your physical body sick.
Wow. And to have a safe place, a safe space for you to be able to just gently, lovingly point that out to them, so that maybe, you know, maybe just feeling that, maybe even recognizing that is enough. You know, maybe even somebody saying it's okay. You know, it's okay that this is weighing you down, because there's, you know, so much shame and guilt and whatever that we all carry around from things, that just oftentimes the recognition of it, or in the okay.
That the recognitions and the provider or the healer and the caretaker have to really point it out and have the courage to say it. And at the beginning, I'm a bit more like, okay, you know what? This is not my territory. I'm not a therapist, or someone can deal with emotional healing. But then identified it, and having that conversation with them is so powerful, because I have not had one patient push back. They always said, I'm so glad you pointed out, because I have a lot of trauma, or I had a lot going on in my life, or I need help. So the funny thing is, the patient know, they're fully aware. It's just that we really don't touch or don't go there, or that discover that layer or that surface.
That's amazing.
So-
Yeah, they felt seen and cared for.
So I love that you combine that in your work, because
oh,
you
good.
always talk about emotional and spiritual in your work.
It is
and you will see
important.
the difference.
Yeah, and as dentists, just having tools, you don't need to learn all this stuff. Just have people that you can refer people to that can help with that. It can be a game changer. You don't need to, and you're so wonderful about doing that. You know, just being a part of that kind of sphere of how can we support each other's patients is just, it's amazing. And that's what I think true holistic health is going to. not feeling like you have to be the expert in everything. Let's all support in the areas we can and build everyone up.
Yeah, and in
So,
return, everybody learn, and we all learn so much through cases,
yes,
and then we be able to help more patients getting
yeah.
better.
absolutely.
Yeah.
That's the goal.
Yes.
So,
We ready for some
thank you.
questions right after Tracy?
Okay, if there
Yeah.
are any, I'm happy to.
Good. So I do have a questions for you. If someone watching this webinar and say, I'm not in Houston, because I know a lot of them not in Houston, how do they find a provider that can do similar work to what you do?
That's a good question. So if you are a CellCore, if you work with CellCore, they do have great networks of people. A lot of us, I see people remotely all the time. So a lot of us will work with people remotely. And that's just a preference thing. I mean, now, since the whole COVID thing, people are more open to work because it was the only option a lot of
That's
people
right.
had. All the testing that we do can be done remotely as well. So that's definitely an option for people, but, reaching out to different practitioners in your area and talking about the things I would look for in a practitioner is one, what's the quality of their education? What's the quality of their product lines? So there's a lot out there that is not so good, but there's a lot that is good. So just look for, high quality. Unfortunately, you pay for what you get for the most part. But look for what testing they do and things like that. Look for, is it somebody that addresses people holistically? So are they going to look at the body, mind, and spirit? Because you want, even if that's not their forte, you want them to be able to recognize those things. And you want them to be able to spend time with people. Don't work with protocols. They can help with people, absolutely, but I am all about individualizing things. So if somebody says, okay, this is step 1 for everybody, step 2 for everybody, step 3 for everybody, I would say, no, that's not a good way to go, because, you're going to have 1 in 3 people having probably a pretty yucky reaction to it because their drainage funnel isn't open. And without leading them, you can say, okay, what do you do when you put people on a cleanse? What are the steps in that framework that you're taking? And you want to make sure that they're working on mitochondrial health first, the drainage funnel. We add in the cell membrane, making sure that that's healthy, and then using binders with the parasite cleanses. So there are lots of really good practitioners out there. Just, and look for someone that you connect with, because you're going to be a lot more open and have a better dialogue, exchange, and support of each other as you work with clients.
Yeah. And I always tell patients this when I refer them. I said, I would not refer you to someone that I'm not a patient of.
Yeah.
And I think that's a very strong recommendations and trust, where patients know that you already know that provider philosophy.
So true.
You already know their GSI manner. And you also know their team. So
true.
It's a very big endorsements, and I would say a trust when the person that refer also seek the care. And so I appreciate you take care of our team and us, and we see your patient and we see the difference that you make in their life. So thank you.
Likewise. Thank you. I mean, I every time somebody needs a dentist, which is pretty much biological dentist, pretty much everyone that comes, I will say, okay, there are a few in Houston, but I'll tell you who I see because she's the best. And I said, it's going to take you a few months to get in. And they go, I don't care. I don't care. She's the best. I want to go to see her. So
thank you.
I'm grateful for all that you do.
Don, you have a questions for us?
Yes. There's a couple. So who was the dentist in San Antonio that you mentioned earlier that was one of the early holistic dentists?
Dr. McRedmond. He retired years ago. He probably retired in the early 2000s. He was wonderful, but Dr. McRedmond was his name. I can't remember his first name.
Yeah.
Awesome. And do you have recommendations for providers in San Antonio for parasite treatment?
I can't think of any, but I'll tell you what, if you get this person's name, I can find out. Yeah, because I know that the CellCore rep in San Antonio, and she's amazing, and she can give me
Yeah.
some information. I'm
It's a
happy to pass
wonderful
that on.
network. I already did joining Cellcore and understand and watching this, the educational series that they have on their website. I know that's a wonderful network and the support
It
is
is.
great.
Yeah, it's great support, great reps, great, the company. I have only good things to say about them, and I've been with them since almost the very beginning. I was at their first conference, so
That's amazing.
yeah, I was a little
Yes.
bitty.
And you always have dentists at the conference.
Always, there are always
Exactly.
dentists there.
Yes.
Yeah, and usually speaking. Yeah,
Mhm.
the last few ones they've been dentists speaking.
Yes.
Yeah, I've got one more.
Okay.
I've had a patient interested in a parasite cleanse in the past, but she was breastfeeding and unsure about moving forward with finding a practitioner for this. What are your thoughts or recommendations for breastfeeding mothers in terms of doing parasite cleanses or going through Cellcore?
Okay, great question. I would never do as pregnant or breastfeeding focus on detox. You just don't want to run that risk of any of those toxins getting into the breast milk or into the baby. However, you can do a lot of prep work ahead of time. So you can do opening the drainage funnel. There's a lot of things that you can do to make sure that the body is detoxing.
Mhm.
Cellcore does have a list somewhere that are what products can you take when you are breastfeeding or pregnant. There are a lot of homeopathics that you can do that can help kind of build the body up. So once the baby's, weaned and you want to go that one step further, you can really hit it hard. You can definitely make sure that the mitochondria are strong, doing things like that. But I would wait for sure I would recommend waiting until the baby is weaned.
Yeah.
Not worth the risk.
I know that they very happy. A lot of people
Mhm.
that watching and listening, very happy to hear that you do work with client virtually or, on
Mhm.
telemedicine, pretty much. And is it an age range? Is it adult only? You do see children? What is your range of the patients in your practice?
We see all ages, all ages. In fact, we have a 100-year-old client who's been coming he's the sweetest man in the world. He's been coming for years to see us and doing phenomenally well, but we've seen 5-day-old babies. So, and we actually have a new program that is it's a personalized parasite heavy metal chemical detox program where you meet with a practitioner once a month, but it's shorter visits to be more cost effective with recorded educational material in between the visits. So it's a lot more, a ton of education, but the practitioner doesn't have to spend an hour every session educating you. You can watch the videos and learn on your own. So it becomes a lot more cost effective less time consuming, and it's going to be a great program. It's like a minimum of 6 months, but if the person wants to go into deeper detox, like Lyme disease type stuff, mold, we can extend it. And
That
lots of
sounds
great
wonderful,
education.
especially for
Yeah.
dentists. We love learning and watching on our own time. So if they join
You
the
have such
program,
little time.
you can get your treatment
Mhm.
and the education
Yes.
at the same time.
Yeah.
That's really wonderful. How do people find your contact information and the program information that you just mentioned?
Oh, thank you. Well, it's actually not on our website only because we are about to launch a new website. So it's all written in the new website. But if you contact our office, we will send you out the information for that. But Heights of Health is my website. So HEIGHTS of Health, HEALTH.com. And there's a contact us page on there, and Stephanie at our front desk will fill you in on whatever she can, and we'll have information that we can mail out to you. And if it's appropriate, if it's something that you want to do, we're there to help.
That's beautiful. And you do have other provider in your practice also.
Yes,
Because I
several.
know a lot of patients of your practice, not only they see you, but they have wonderful provider in the
Okay.
practice. that
Yeah, we
they
have
from.
great providers who have been with me and trained by me and other people, but they've all been at least 7 or 8 years, if not 17 years with me. So I'm really, really, really grateful and touched. They're amazing, amazing women.
That's beautiful. Thank you so much, Dr. Tracy.
Oh,
I know
thank
that we
you.
asked a lot more questions than we set out the Q&A session for. And we'd love to have you back and talk about more of the topics that I know a lot of people requesting, such as the Lyme disease, you just mentioned that,
Mhm.
heavy metal, mold. Those are the things that people
They're
always have
big,
questions about.
big
Yes.
issues. So I'm happy to. I love talking about it, and I really appreciate you having me on and all of you being there and listening, looking at the yucky pictures. But
We've seen a lot worse than
oh,
that, so.
oh, I bet you
yes,
have. I
yes.
bet you have.
Thank you so
So
much.
wonderful. Thank you.
Guys, make sure you follow Dr. Tracy and her practice, HighsAppel.com, and her also social media handle is a HighsAppel. And we will tag all the information in the post for you guys. Thank you so much for tuning in. We'll see you guys next time.